Hi, my name is Lavonne Ansari. I'm the CEO of the Community Health Center of Buffalo. The Community Health Center of Buffalo is a federally qualified health center that actually provides primary care, dental, comprehensive services to those of us that can't afford it. While we take everyone, we actually serve people that are underserved. One of the things that I've chosen to do is to share some of our experiences with COVID, some of my staff experience who are also patients that included my providers, some of my frontline staff, because our stories are not told in the communities that can be most beneficial and educate as to the importance and the hardship of this disease. There's a lot of myths out there about COVID-19. But we wanted to share this opportunity of those of us that are working in healthcare and have firsthand experience both providing services as well as actually some of us contracting the disease to tell our personal stories so that we can best educate through our own experiences. So I've had some of my staff talk about how COVID-19 has impacted them. Some of them live with people that have contracted COVID-19 and did not get the disease, while others did get the disease and their families got the disease. So I wanted to share those stories so that the community can be educated and learn from us, from firsthand experiences. Thank you. So I just want to thank everyone for participating. This is an opportunity for us to tell our story, particularly as frontline workers. We see everything on TV about hospitals and how much they're struggling with us with the COVID, and it's very, very hot right now all over the country. And I wanted us to take the opportunity to talk about our story. As primary care providers, we have a hygienist, and how exciting in some ways to be able to talk about our own experience and share with others, not just as healthcare providers, but also personally. So I'm just gonna have you guys go around and say who you are and what your title is at the health center, and then we'll start our conversation.
My name is Michelle, and I am a certified medical assistant for CHCB.
My name is Dr. Kenyani Davis, and I'm a general internal medicine and preventative medicine physician here at Community Health Centers of Buffalo.
My name is Denise, and I am a personal customer care person. I'm every woman, whatever I need to be.
My name is Nicole, and I'm a dental hygienist here at Community Health Center Buffalo.
Tell us a little bit about your experience with COVID.
I can go first. I literally just got back from COVID. It was kind of surreal. I mean, being a physician, we had already been in it for 8 months, and fatigue had set in, and you were tired. And all I can think of is I saw a patient, we did all the right things that we were supposed to do, and felt okay. And then that Monday started to have a headache, and it just seemed a little off, but you pushed through it like you pushed through everything else, because we were all tired. And then I started to see the person's labs come back, and then as the day progressed, it just didn't seem right. And I had to go home. And I think, honestly, in that 8 months was the first time I realized that I was human and I was not invincible. Because I think through this whole process, you felt invincible because you never really stopped to think otherwise. So it was scary. It moved my empathy to sympathy. And I had taken care of so many people with COVID, and I had never had it before. And it wasn't anything like I thought it was going to be.
So Dr. Davis happened to be one of the original members of our COVID team. So her sharing her story comes from a space where she was on the ground of actually helping to protect all of us in the health center and having the safety precautions that we needed. And So this is why her story is special, because she's still one of the lead physicians in the treatment, because we didn't know what this was. And she was one of the first providers, along with a couple of other providers, to start looking at how to treat symptoms of COVID, even though we knew nothing about it. So go next.
So for me, mine's kind of a unique situation because as Dr. Davis had mentioned, all through the last, say, 8 months of going through the pandemic, in the beginning part of it, obviously, the unknown, was very scary for us. And so we took our precautions at work. We did our best in keeping distance and PPE. And so I guess working in healthcare, you assume at that point that if you were to become infected by COVID, it would be in that field and in doing your job. And I will say that after all this time has gone by, you're aware that it's still out there, but you can become a little bit complacent and desensitized. And for me, my infection came from actually my own home, which was probably the last place I would have expected to contract it. So my husband actually became infected first. We weren't aware that he had COVID, but based off his symptoms, it was pretty evident that he potentially could have it. So we had him tested. A few days later, my daughter had become symptomatic again. Didn't know for sure if it was COVID at this point, but given the circumstances, we assumed it might be. Had her tested. They had both tested positive, and at this point I had no symptoms, but kind of assumed, given the close quarters, that I might contract it. And my symptoms started very mild, probably a few days after my daughter's, which became more muscle aches, just a little bit fatigued, no cough at this point. About a day or two into the symptoms, I developed the cough, the little chest heaviness that people talk about, the shortness of breath. I did not actually have a fever. They say that that's usually one of the main symptoms. I didn't have the fever, but the cough did progress, which for me, when I look back, symptoms-wise, I would say it was probably more of a mild case. However, even in the mild symptoms that I was experiencing, I think overall the mental part of it and the mental strain and emotional strain of all of the unknown, and you start to think back to 8 months of research and reading and understanding that every person's symptoms are different, every person's experience is different, and you really truly don't know how it's going to personally affect you until you have it. So sitting there each day wondering if it was going to progress into something more severe and whether or not I would need to go into an emergency room, which I think is a fear for some people and many people. I'm grateful that it didn't get to that point for myself or my family. So we are all better, and I'm grateful and thankful. However, it's definitely something that I never want to experience again.
Nicole.
Okay.
Thank you, Michelle.
So when COVID first came to the United States here, I had just started my job here as a dental hygienist. So I had only worked here, maybe like 8 weeks or so. And so at that point, we were just wearing regular surgical masks. And then as it maybe progressed a little bit more, we started wearing a face shield. And then we were quarantined. I was laid off from work, because it's due to the aerosols. I'm sitting there, a foot behind someone with their mouth open. I'm using instruments that are, spitting saliva into the air. And so I was home for a few months, well, not a few, maybe like 4. And I did everything I was supposed to do. I live, it's just my husband and I in our home, and we took it very seriously. We didn't even go to the grocery store. We had all of our food delivered. We didn't see any of our family, thank God for like Skype and stuff like that, and just phone calls. And so we were really home, and we really did, because we knew it was serious. So fast forward, we're back to work, and I feel okay, because and I wear an N95 mask, and I also wear, my surgical mask. I now cover my hair, and then I have my face shield, my gown. So really all you see is my eyes, So, the dentist that I work under, she's reassured me that, very few people in the dental world have contracted COVID from work, because of the amount of PPE that we wear. And so that has made me, feel better about coming here every day. So about 12 days ago or so, my husband, and even still with him, he goes to work, goes to the grocery store, and comes home. We haven't really seen anyone. We've just been kind of keeping to ourselves. And he, a couple people that he works with ended up coming down with COVID. So he was sent home from work, and they wanted him to take a test. And so he did, and that day he went home, it was a rapid test, and he was feeling, a little achy. And so, 30 minutes later, come to find out, he tested positive for COVID. And so he contacted me at work to let me know, and of course I was like, I'm buttoned up my area at work, went and told, and so then I went home, and well, before I did, we have a mobile unit here that we do COVID testing right at the facility. So I got COVID tested, and then I went home, I grabbed my Lysol wipes, I went through the kitchen, and I kind of, in that point he was just achy. So I kind of said, what's our game plan here? Okay, where's your home base gonna be, So we have a finished basement, so we have, a couch and a TV and stuff down there. So we ended up taking the mattress out of a spare bedroom, bringing it down in the basement, and he's been down there ever since. He's still down there. We keep the door shut. I think one thing that I've been doing that I think, just my opinion, has helped is I've been keeping the windows open. And so the window in the kitchen is open 24/7, and then also like last week, when I was home from work, I was in my bedroom most of the time, and I had the window cracked in there too. And even now when I come home from work, I open it all the way, get everything flowing in there again, and so he's been like a roller coaster of symptoms. At first, he's never had a fever. He really doesn't have a whole lot of congestion. It's a lot of achiness. It's just a lot of fatigue. Very, very tired. Just here recently, he's had like some terrible stomach issues, and that's when he gets like these bad stomach aches, then it seems to like bring everything back. Then he feels like the aches again, and just all the symptoms that he was having, that really seems to wipe him out, as the stomach aches that he's had just here lately. So every day is one day closer, we're hoping that we're around in the corner here. And it's just still amazing to me that I didn't get it.
Yeah.
It is.
Yeah, you took great immediate action, isolation.
Yep.
You're naturally wearing PPE because of what you do for a living.
Right.
Opened up the windows. He's in isolated, so the social distancing works.
It
right?
does. Yeah.
And so we're blessed, and so Nicole, you tested negative still.
Yeah.
So great. Denise.
Okay. I also felt like I couldn't catch it because I'm always on the go. I'm always doing something. I felt like I had protected myself. When I caught it, it was early. So we didn't really know much about it. And I work with the patient population, and I love the patients, and I'm near them, and I'm helping them, and I'm doing this, and I'm doing that. And I was at work working one day, and it was like a curtain came down over me. And all of a sudden I felt like, wow, I feel like I could lay on the floor and go to sleep. And I'm like, no, I'm gonna push. And they said, no, you're not. You're not gonna push. Then it got to the point where I said, I think I need to go home now, because if I don't go home, I don't think I'll be able to drive myself home. So then I called my supervisor and I let her know. And so she said, okay, go on home, let us know. So then when I get home, I live alone. So my daughter lives upstairs from me in the apartment upstairs. I didn't call her or tell her, well, actually she was at work, so no one was at home but me. So I'm sitting around and I just wanted to sleep. And I got a phone call from my supervisor, and then she told me that I needed to be tested. And I'm like, for what? There's nothing wrong with me. I'm sick. I have the flu. What are you talking about? These are flu symptoms. So I got tested, and then when I got the test results and I was told that I had COVID, I was shocked. I'm like, not me. I don't get sick. Nothing catches me. Listen, hey, I don't have a fever. I'm not coughing. But then, like I say, within 2 days, I developed a fever. I wanted to sleep all the time. That's all I wanted to do. I would get from the bed to the couch to the chair. Every time I would just sleep. And then I had the fever. And then, of course, I had to inform my daughter, and my daughter cried, oh, Mom, oh, Mom. I'm like, I'm not dying. I'm okay. But I just want you to keep the kids upstairs, because she has 4 children, and we'll work this out, So my oldest daughter is a nurse. I let her know also. And she was like, well, Mom, she gave me some things to do and what not to do. And my daughter that lives upstairs from me just checked on me. She would wear the mask and come and take my temperatures and make sure I lost my appetite. I didn't have the coughing, but I had the fatigue and the fever. Then eventually, the thing that really scared me the most was when I lost my taste and my smell. Because now it was an incident where I had a clog in my sink and I used some kind of chemical anyway, I put it in the sink and it made a gas come throughout the house, which I didn't smell. I'm sitting there, I'm watching TV, Hallmark crying, My daughter from upstairs is knocking on the door. What are you doing in there? What are you doing in there? What do you mean, what am I doing in here? I'm sitting in here. She said, Ma, open the door. So I had to let her in. And she's telling me, go outside, go outside. And I'm like, what? So I go out. The fumes had came up into the house, but I didn't smell it. So she, takes me out. They open the windows, air out the house. And what are you using? And all this other stuff. So then got all that straight. And then I come back in the house. And then that's when I noticed, because I had lost my appetite, so I really wasn't eating like I normally eat. And that's when I noticed the next time I did eat, the food it just tastes like stuff in my mouth, and I couldn't swallow it. I had to swallow the food, swallow it. But then it got to the point, it doesn't register with your brain, so you don't want it. So I stopped eating. And that's when she would make things for me and say, what's in this? And or make me close my eyes, and I couldn't identify it. So that's when I knew I had lost my taste and smell, and I stopped cooking, and they banned me from the oven and everything, so because I couldn't smell, and that was scary. I think that was the most scariest part, because I didn't have the coughing. I just had the fatigue and the fever for maybe 3 or 4 days. So, but after I got past that, then the fear of spreading it to my grandchildren who live upstairs, who are so used to coming, because we live in the same house, so it's like a 1-family house, even though it's a 2-family house. So we had to separate, and and I would talk to them through the door, and going through that process, and that was a process living alone, because you think a lot, and I didn't want to go to the hospital either. And I'm thinking if it gets to the point where I have to go to the hospital, oh God, no, please. So, but it didn't get to that point. But going through the process, living alone can be scary, because your mind can take you to all different places and then you're not sure, am I doing the right thing? And sometimes also it makes you be a little more lax about disinfecting and wiping things down. I had to make sure that I made that mentally in my head. You're here alone, but still do it. still do it. You're contaminating yourself with your own stuff. You know what I mean? So wipe it down. You know. So.
So there's a couple of things that Dr. Davis, you can probably help us on. I heard a couple of things, GI and neurological, that some of us experience. So can you talk a little bit about that?
Yeah, so originally when it came out in Wuhan, China, it was a respiratory illness. And then however, when it went into the community, people were starting to report more GI symptoms. And I can say, especially for our community, a lot of people were having GI symptoms, and that ranged from just a little bit of stomach cramps to diarrhea, to maybe a little bit of nausea. But overall, as you can see, everybody's symptomatology was a little different. I can say for me, it was the headache. The headache was unreal. The headache was unreal. The muscle aches were just unbelievable. And really now what we're seeing now is not only we all went through this, and I think we're all having like PTSD hearing about everybody else's stories, but the recovery phase, there is some neurological stuff with the recovery phase, and memory loss has been one of the things. And I can say that, so Michelle and I work a lot together, and that was the thing we were talking about yesterday, is that the finding of the words is really hard. And when you have a cerebral job, that's hard. I mean, I have got to tell you, and I don't know how anybody else feels, I discredited what it would be like to recover. I thought I was just gonna jump back into my old life. That didn't happen. And I also discredited the anxiety associated with this entire process. I had to shut the news off. I mean, it hits different when they start saying coronavirus deaths and coronavirus cases. It hits different when you're the one sitting there not even knowing, okay, am I gonna be the 257th, 353rd patient that's gonna die today? For 8 months, I researched this stuff. For 8 months, I took care of patients, and not once did I ever think about the anxiety that took. The anxiety almost took me over the edge. That's what took me over.
So when you all are talking about the anxiety, and there's different levels of it, you have it from having your husband, and then that anxiety is something that people can't see. So what are some of the suggestions that you might have as to how, as a healthcare provider, we actually recognize that and begin to help you to manage those things? Because you can't see the brain, right? You know the brain is there, but you can't see the mind, right? So as a us in healthcare, what are some of the things you think we can do to begin to address some of the anxiety and the psychological effects that's coming from COVID?
I mean, I don't know, but I know for me personally in my own home, for people, I think having a support system, a solid support system, is key. And I think as healthcare workers, we need to first address and isolate patients that maybe don't have that, because if you don't have that, like you were saying, being alone, which this particular virus, it's not only physical, mental, but there's an isolation that happens, and even if you're living in a home with other family members, but in separate areas, you still feel alone. So I think people need to have some type of support system, because for me personally, my husband battled severely with it because he had a fever for 12 days straight. And it was a constant coming to me for some type of reassurance. And I think we all as people can sometimes focus so much on the negative. And when we see so much negativity that is being displayed out in the media, and not to say it's not real, I mean, these things are real, but sometimes we just need to be reassured and encouraged. And having a support system, I believe, is one key thing that we all need to have to help get through the mental part of what we go through, because it's like a wave, as we've discussed. It's the symptoms, you feel better, you feel like you're getting better, and then all of a sudden you start to feel bad again. And it's the roller coaster, the up and down. So a support system, I feel, is key too for people to have at home.
Excellent. So the journey is not just the physical journey. It's the psychological that might take longer than the physical.
Yes. And even after the symptoms have subsided, I know for me, I speak personally, I am no longer symptomatic to some degree. I feel like there's some residual, like we were saying, the memory loss. I also lost taste and smell, which has now come back. But even though I'm back to work, I'm back functioning in a certain way of normalcy again, the mental part of it, talking about it, thinking of potentially getting it again in the future, like that is huge, like weighing.
So the anxiety
Oh,
of
it
feeling
doesn't-
that you're going to get it again.
Yes, oh, yes.
How about eating? Did you change your diet at all? Was that part of some of the?
I think my eating was affected, and actually I think it still really hasn't gotten back, because I used to eat everything, but when I lost the taste and smell, and food just now doesn't have the same.
So
It's
that
not
takes,
as appetizing to me as it was before I lost my taste and smell.
and you were
no.
beginning COVID, so you were like March or
Right.
April. This is now November,
Yes,
December.
Yes.
So just from you all's experience, you're talking about months. This is
Yeah.
not just. So we're looking at not just the physical with the taste, smell, appetite, but the psychological can go on for months.
And it's just like Dr. Davis said, I thought that, okay, once all these symptoms are gone, I'm just gonna get up and I'm gonna do this and I'm gonna do that. And everything was like, I would do stuff and have to take a nap. I never take naps. I have to make myself to go to sleep at night. So for me to be taking a nap, and then I said, oh, no, this is not right. You still have it. But my body needed that rest. I had to, and it made me respect it, because I wasn't doing anything because it would overtake me. So I started taking, and I do. Even now, I still take, if I could take a nap, I take a nap, which I never done.
And I would say once I got better, or not better, but I did my 14 days, right? I just went out to water the plants. I wasn't doing anything wonderful or beautiful. I called you. The amount of weight that was on my chest felt insane. And then I cried because I was like, I'm never gonna be able to go to Target and walk in the line again. Like, this is what my life is gonna be like, you know? And so then the breakdown happened, and I was like, all right, get yourself together. But then once I thought I was better as the 14 days. I went back out into, the family room and everything. My husband, my kids, they treated me like I had the plague. So they were just like, just because you think you better and the CDC says you can come out the house, hold up now, you can't just be coming up in here like this. But so that was another dynamic, They were like, can I hug you? Can I not hug you? They made me wear another mask. So they're making me wear a mask for another 2 weeks. And so I get it. They got anxiety too, right? Mommy's got the plague. So it was more than I thought.
And even with me, it took me, actually right now, I'm just back to hugging my kids. I won't kiss them though.
Right, me
My
neither.
grandkids,
Me neither.
and we are a kissy family.
I know.
We kiss all the time. But now, I'll just give me a hug, and
Right.
when I hug, make sure I turn my
Turn your
head.
head, yeah.
So you are conscious of things like that.
Yeah.
So if we want to educate the community, what would you do? What would you share?
I would say that this needs to be taken really seriously. I think everything that you hear on the news and all the precautions that we need to be taking is not something to push to the side and act like it won't happen to me, right? I mean, because my husband, all he did was go to work. I mean, that's what we're supposed to be doing now. We're supposed to be carrying on, And I think that that's probably the most important thing, is taking it seriously, keeping your distance, not going to people's houses, not hanging out on the weekends. I know that we can't go to restaurants, we can't go to bars, but try and find something in your own home that you think is fun to be able to pass the time, and call people on the phone, versus seeing them in person.
And I think also, don't judge everything by time. Okay, 7 days, I'm good. 14 days, I'm better. 30 days,
point.
I'm completely healed. It doesn't work that way. And I think people are different when it comes to that. You know, some people 7 days maybe. Some people might take 30 days. You know, don't time your healing or recovery by days,
That makes-
because you'll be disappointed. If you don't make it, like, okay, at 14 days, I still feel terrible.
But
You know-
that's excellent, because as healthcare providers, we don't necessarily understand that, right? We're just looking at it clinically. The CDC says 14 days, you good. But we're not also looking at the residual and how to also manage the psychological with the physical, because it takes longer than we think.
Yeah, I know too, like my husband's coworker, that they were both, they work closely with each other and they both tested positive. And he's an older man, you know, maybe like in his early 60s or so. And my husband's like mid 30s. And his coworker has already tested negative. He feels so much better. And like, here's my husband, you know, years younger than him, still sick. You know, he's like, I'm sure I won't test negative, you know, and that just goes to show you it's different for everyone. Everyone has different symptoms. The body heals everyone, you know, at different times, you know, it's just,
Great. I mean,
it's kind of crazy to think that you would think that it would be like more systematic, but it's just really not.
any other things you want to talk about that we haven't discussed? We talked about posts, we talked about our families, healthcare providers.
I would just say the toll that it took on my family that I did not realize. I think I went into this profession knowing that there was going to be occupational hazards, right? But I guess I never in my life thought there'd be an occupational hazard where I could bring it home to my family to have an adverse, you know, reaction. I mean, you know, I can go to the hospital, I can catch pneumonia, I can catch the flu, I can catch E. coli, which probably wouldn't be that great. But I mean, nothing that I could bring on that would really impact somebody. And my husband, my son, they have asthma. My daughter, my youngest daughter, actually had open heart surgery when she was 2. And how I felt waiting for that test, I was devastated. It just, I felt awful. Like I never in my life felt like I chose myself or my profession above my family. But that was the one time I was like, God, you were so selfish, right? Thank God they didn't get it or anything like that. But it hit hard because my 4-year-old couldn't go to daycare. And so she sat by the door and colored so mommy wouldn't be alone. And that hurt. And then I came back to work on that Monday just to hear a patient, when I was doing telemedicine calls, say, yeah, you know, well, I got to get this tested, but it's not real anyways, and it's not this. And like, it was a dagger in the heart. Like, how dare you? How dare you? But you have to stay professional. You have to stay this. And so you start to feel this anger and this resentment. And you ask yourself, like, how do I get past all this? How do I keep moving? My personal and professional worlds never collided before in the years of medicine that I've been doing this. And I think this pandemic has made that happen. And I don't know how you navigate. I don't know how you navigate that. So that's the only thing that I would say that, I don't know if anybody else felt like that, but I don't know how to navigate that.
We're going to take one day at a time. How about that? One day at a time.
I think everybody needs to do their part, and I think for me, that was eye-opening too, because the way I contracted it was one person. The contact with one person, it actually trickled to 6 people becoming infected. And so I don't think, and I say this humbly, that having walked through this, I don't believe that people who have not, and I don't wish this upon anybody, but I don't believe that somebody, unless you actually go through it and experience it, you can't really truly understand, even because people will look at maybe our situation and say, okay, but you didn't go to the hospital, you weren't on a ventilator, you were able to stay at home, it was mild. Even the mildest case, I know that I could have, my COVID, my positivity could have affected somebody that maybe they weren't as fortunate. And so I think everybody has to do their part and understand, like with a normal virus, like a flu, say, people know you're usually, there's a standardized, you know, you get the fever, you get the aches, you may develop more severe symptoms, but it's 3-5 days, whatever, and you're better. With COVID, you don't know how it's going to affect you until it affects you. And I just think our younger generation, I have adult children, young adult children, who, thank God, have not had to experience it, but there's like an attitude, I feel, in the younger generation that they're either immune to it, or if they get it, it's not that bad. And yes, and they don't understand that how that lax could affect other people. And
Yeah, and pass it on to everyone else.
And that's why these conversations are important to have, so that we can share them, because this disease is not going anywhere. And I know all of you personally, and I think I have not experienced it, but I've experienced your pain and trying to really help navigate bringing, as an employer and as friends of most of you, your wholeness. So I just want to say that the best thing I think we can do for each other is to listen, just listen, and be able, words of encouragement, because we need to explain to people this is a journey. We don't live in the health center, we live out in the world. So I want to thank you all for sharing your experiences. We got a lot of work to do, but what's important is that because you have experienced it, you help those of us to not want to experience it. So thank you all, and let's be each other's support, as you said, and we'll keep learning. Thank you.